Hello everyone, my name is Sydney. I'm a senior in the Math Science Technology Center program here at Paul Laurence Dunbar High School, and today I'll be talking to you about my senior 360-hour capstone research project, which was assessing the system-wide effects of mild traumatic brain injury. I conducted my research under the mentorship of Dr. Lin at the Sanders Brown Center on Aging at the University of Kentucky. So just as a brief overview of my presentation, I'll first provide some introductory information to give you some background knowledge of my project. And then I'll dive into the purpose, hypothesis, and methodology of my experiment, and then show you the data and the conclusions that I drew from it. I will end my presentation by talking about some extended research that I would like to do, acknowledge some very important people, show you my references, and then open the floor up to any questions. So let's get started. Traumatic brain injury contributes to around 2.87 million emergency visits, hospitalizations, and deaths in the United States alone. And up to 90% of these injuries are classified as mild. So mild traumatic brain injury, also known as MTBI or concussions, can result in loss of consciousness, disorientation, difficulty thinking, memory problems, sleep alterations, and mood swings. So these symptoms are very comprehensive and widely known. So though the visible symptoms of MTBI are greatly detailed, the actual impacts of MTBI on the brain and the body still remain a mystery. No one exactly knows what happens within the brain, which parts of the brain are most affected, and what exactly really happens. In addition to that, there's a lack of long-term studies in literature to exactly note if the consequences that we see on the brain continues for a long time after injury. And so the current treatment for mild traumatic brain injury is only just sleeping, resting, drinking lots of water, taking pain medication if need be, and taking physical therapy if needed. And so there is really no effective treatment for mild traumatic brain injury. And so to determine an effective treatment, we need to know the long-term impacts of MTBI and to detail what exactly happens within the brain. So this is where my project comes in. The purpose of my project was to determine the long-term system-wide effects of MTBI so we can find that effective treatment plan for MTBI patients. I asked the question, how does MTBI affect the brain and the body? And I hypothesized that mild traumatic brain injury would decrease brain function and negatively modulate circadian rhythms or sleep cycles. And so I wanted to look into exactly what parts of the brain were most affected by MTBI and see if the sleep cycle was modulated in any way. So to set up my experiment, I had two groups of age-matched male mice, closed head injured mice and sham injured mice. So the sham injured mice did not receive an actual injury. So the injury was done when the mice were 4 months old. This is comparable to around 25 to 30 human years old. And so both groups of mice received a midline sagittal scalp incision at the top of their head. However, only the injured mice received a blunt force impact on their skull. I wanted to keep both of the groups as similar as possible before injury was actually inflicted, which is why the sham mice also received that procedure incision. To continue and look at the brain function, I analyzed cerebral blood flow and diffusion tensor imaging data. I retrieved this data from MRI spectroscopy, and the analysis was done when the mice were around 7 months old. So this gives a longer time frame to see what happens inside the brains of these mice after a long period of time after the injury. To analyze circadian rhythm, I looked, the mice were placed in light boxes 1 week before injury to establish a baseline, 1 week after injury to look into the short-term effects, and 6 weeks after injury to determine the long-term effects of mild traumatic brain injury. And their locomotor activities were measured with monitors. So now let's first take a look at cerebral blood flow. Cerebral blood flow looks into the blood flow of certain parts of the brain. So if we first see the global, which is the brain as a whole, the thalamus and the hippocampus, there was no significant decrease in cerebral blood flow in these areas. But if we continue and look at the proximal cortex, both the left and the right side of the proximal cortex and the proximal cortex as a whole, we see that there was a trending decrease in cerebral blood flow in TBI mice compared to sham mice. This is only trending, but this definitely is very important information, because if we use a bigger sample size, if I used a bigger sample size, or possibly had inflicted an even harsher injury, then it may show significance. So this is definitely very important to look at. The proximal cortex has to do with attention, memory, and consciousness. So seeing that there was a decrease in cerebral blood flow in TBI mice compared to sham mice may show why we see these kind of problems with attention span and memory loss in patients who suffer MTBI. Next, moving on to diffusion tensor imaging, DTI looks into the diffusion of water in the brain. So you definitely want a more concentrated flow of water rather than a diffused water in certain parts of the brain. And so we see that in the whole brain, in the internal capsule, there was no significant difference. However, in the external capsule average, there was a decrease in DTI. So there was more diffusion of water in TBI mice compared to sham mice. There's a trending decrease. And in the external capsule connects the basal forebrain to the cerebral cortex. And these parts of the brain are vital to cognition, attention, and memory. So again, it goes back to what I said about the proximal cortex. It may show why patients who suffer MTBI have attention deficit issues and memory loss. Moving on, we see that there was no significant difference in the CC. However, there is something very interesting, fascinating in the fimbria. In the fimbria, we see that there is actually a significant increase in DTI in TBI mice compared to sham mice. This is kind of unexpected, but if you examine a little bit more, the fimbria travels along the hippocampus, which has to do with learning and memory. And hippocampus is very vital to the brain function. And so this may be the brain overcompensating what had happened and overcompensating the injury, and therefore increasing DTI in this particular area. But we see here that only this area there was a significant increase, while other areas failed to heal in that certain way. Finally, looking into the circadian rhythm, surprisingly, there was no significant difference between any of the groups, and I'll definitely go back to this later. So finally, looking into the conclusion and summary of the data that I just showed you, mild traumatic brain injury does sustain long-term health effects on certain parts of the brain. We saw there was a decrease in CBF in the proximal cortex, which had to do with attention, memory, and consciousness. There's a trending decrease in the external capsule for DTI. And then again, this part connects the basal forebrain to the cerebral cortex and has similar functions to the proximal cortex. And then there was a significant increase in the fimbria for DTI, and the fimbria travels along the hippocampus, which is very vital to learning and memory. And so this information is very fascinating and new because it shows that these are the parts of the brain that are most affected by mild traumatic brain injury. And so this can provide new research opportunities to look into new treatment plans for just these parts of the brain and target and heal these parts of the brain. And so in the end, my conclusions show that time may not be the best way to heal certain parts of the brain. As we see here, there are still parts that still are facing consequences from MTBI. And so definitely we want to look into new treatment plans and more effective ones. And so this goes on to my extended research. Firstly, I want to do a deeper and new analysis of the circadian rhythm. So we saw that there was no significant difference between any of the groups for circadian rhythm, which was very interesting. Both the and this be made because of a couple of issues. Firstly, both the sham and the injured mice were anesthetized with isoflurane. So isoflurane may have an effect on the sleep cycle, and so there were some studies on that, and so definitely I want to see maybe if there's a new procedure that we can do when both of the mice had to have that incision at the top of their head, maybe looking into a different a new way for that. And nextly, I measured their circadian rhythm using activity counts, which may not be as comprehensive as other ways to analyze circadian rhythm. So definitely I want to do a more comprehensive analysis of circadian rhythm to really see if there was a significant difference in circadian rhythm between these two groups or not. In addition to that, my next steps are to look into the impacts that MTBI have on the body, and specifically the gut microbiome. So there has been a lot of emerging evidence showing that your gut bacteria is linked to the function of your brain, and the function of your brain may be linked to your gut microbiota. And this is because of the gut-brain axis. And so I want to see if MTBI, when inflicted on the brain, may have altered the gut microbiome, and to determine if there can be a new treatment measure for mild-traumatic brain injury through the use of diet. And so this can bring a new preventative treatment measure for mild-traumatic brain injury and help those possibly prevent the effects of mild-traumatic brain injury, or possibly help people recover from it. So I'm very excited about the next research that we can get from this project. So of course, there are several people that I want to thank for helping me through this project. Firstly, I want to thank my wonderful mentor, Dr. Lin, for opening me up to the research world and welcoming me to her lab with open arms and teaching me so much about research. Next, I want to thank Lucy, who helped me so much through this process and I asked her so many questions, and she was always so happy to answer them. I thank her so much for letting me just tag along with whatever she's doing and being so kind. And I just want to thank the rest of the Lin Brain Lab for creating such a wonderful, caring, collaborative environment for me to conduct research. I also want to thank the Kentucky Young Researchers Program for giving me the opportunity to conduct research at the University of Kentucky. I also want to thank the Math Science Technology Center and Ms. Young for helping me get started with my project and continuing and finishing it. And I'm so excited as to what I can do next. And lastly, but not least, I definitely want to thank my family and friends for letting me hitch on rides to and from lab every single day, and just always being there for moral support. So here are my references. And so I just want to thank you guys so much for joining me today. I hope you guys learned something. And if you guys have any questions about whatever I presented, please feel free to reach out to me. I'll be so excited to answer your questions. And thank you again.